He's an all-pro. I mean,
For shares.
Hi. Benga. Nice to meet you.
So both you and Dr. Fasania have prepared handouts if you need them.
I need it.
At the head of the table. Otherwise, we'll have to distribute between whoever sits here.
But so, look, we read it from here, or do you read it from the screen?
I usually read from the screen, but I like to have that just so I know what the answer is for some of them, because
Okay, so we can have these.
we can have these. Yeah, we should hold on to those. We need these more than they need it.
I might have you sharing it with me so that. Fairness between the X and STS. I intentionally didn't print it.
So you come from how? I work there. My eldest son was born in Beverly. So I used to work Castle Hill and Hall Royal.
Can I come?
All right, okay. Miguel was born in Beverly.
I don't even know who this is.
Very nice place. We used to live there.
Really?
I literally have no idea who this is. There are actually a fair number of Okusanyas, and because I have Okusanya
We'll see.
at Gmail,
Once you're done eating.
yes, as I'm done stuffing my face.
No, it's important.
Uh-huh.
Settle your stomach.
And then he's got to be well fed.
I don't do well hungry in the OR. Like we're ready? Oh, wow. Okay. Okay. All righty. It's happening. It's happening. All righty. Everyone, let's get your attention. Thank you so much for coming to the finals of the CT Surgery Showdown. Let's give a big round of applause for everyone that's been involved thus far. All righty. My name is Bengo Kusanya. I'll be one of your hosts tonight, representing the STS.
And I'm Rafa Sadaba. I will be co-hosting this event today.
Excellent. So tonight we want to make sure that we express how much of a collaboration this has been between STS and EACTS. We also really want to thank our staff, our amazing STS staff, for all their hard work over the last year. Round of applause, round of applause. We would also like to thank all of our question writers who are up on the board here, who dedicated their time and expertise to drafting these questions. And we would also like to thank our judges, Dr. Farber, yes, Dr. Batista, Dr. Pompili, Dr. Mintzman, and Dr. Shi for being here to make sure everything is fair and square. All right, you want to introduce them?
So we'll introduce the two teams. As you know, we'll have the European champions from Italy. Will you introduce yourself, please? Can we have this mic on?
I'm Francesco Bertelli from Padova, PGY 5, Cardiothoracic Surgery Resident, and currently at the Sick Kids of Toronto. I'm very interested in congenital.
And I'm Marco Giamelli from Padova, 5th year PGI 5, and my main interest is adult cardiac surgery.
So they did a great... They did a great job on their qualifiers in Europe, in Lisbon, in October last year. But let's see how today they do against our Iowa team, please.
My name's Joel Bedreau. I'm a PGY2 in the integrated program at Iowa.
And my name is Kyle Walsh. I'm a PGY 4 in the integrated program, interested in adult cardiac.
The team at Iowa had a dominating run to get here earlier today, so we'll see if they can keep it up in this next round.
I mean, it was amazing this morning,
yes,
wasn't it?
Quite impressive.
It was impressive.
All right, we have a few brief rules that we want to go over as well.
Okay, so rule number 1, the host will begin the competition by reading the rules. That's what I'm doing, and categories. As you can see, we have different categories, and you can bid for all of them. So each round begins when the designated team selects the category and dollar amount. Okay, so you can say common bonds for $400, okay, and then we play that. Number 3, once the host has finished reading the clue, all teams may buzz in. So you may confer before buzzing in to the team. But this is important. If you press the buzzer before the question is read, you lose that, okay? Then the first team to successfully buzz in has 5 seconds. We'll count 5 seconds to answer the question. And remember, you must answer in the form of the question, okay? You want to carry on with the rest?
Yes. Thank you. Also, so when you answer, if you answer incorrectly, points will be taken away from your score. If you answer incorrectly, the other team will get 5 seconds to decide if they want to answer and try and steal the points and steal control of the board. There are daily doubles on the board. So if you get a daily double, you can bet anywhere between 100 and the maximum of your score. And that team alone is a team that can answer that question. Okay?
If we don't answer a daily double, we get...
If you don't answer the daily double, you lose the points that you wager. So, and for the final question, we will show you the category. You will wager an amount. Then we will show you the clue. And then we will review your scores. If there is a tie, we also have a tiebreaker question based on that. Okay, so we have a coin here that we're going to flip a coin. So this is heads, this is tails. We'll let our European colleagues, because they are our guests, do you want heads or tails?
Tails.
Tails, he says. Let's do a redo. Heads. So you guys get control of the board first. All righty. Where would you like to start?
Get to the beat 600.
All right. Get to the beat 600. This structure is defined by the tendon of Todaro, the coronary sinus, and the septal leaflet of the tricuspid valve. University of Iowa.
What is a triangle of Coke?
What is a triangle of Coke? Correct. Excellent. 600 points.
Get the beat 800.
Oh, wrong team.
Yes, 600 should go to Iowa.
Yes. Yes, yes, yes.
She's on it. She's on it.
She's new.
First time.
Just making sure you're paying attention.
That's right. All righty. Iowa, you have control.
Get the beat 800, please.
Okay, so this score is utilized to assess favorability of percutaneous mitral balloon commisurotomy for the treatment of mitral stenosis.
Iowa.
What is the Wilkins score?
That is correct. All right, Iowa, you still have control.
Get the beat 1000.
Get the beat 1,000. This is an abnormal cause of dysphagia that can be identified by the included barium swallow and CT scan. 3, 2.
What is a
Padova.
comoral diverticulum?
What is a coronal diverticulum? Correct. Excellent. Padova gets on the board. You guys have control.
We're gonna take common bonds for 600.
So this procedure is used when a superior sinus venosus ASD is accompanied by very high right superior pulmonary vein drainage.
What is a Warden procedure?
That's correct.
All right, Iowa, you got the board.
Common bonds 800.
Common bonds 800. Use of this systemic pulmonary artery shunt is associated with reduced mortality for stage 1 palliation of hypoplastic left heart.
What is a sinoshunt?
That is correct. Padova gets it back. All right, now I like this. This is competitive. We doing it here.
So
Okay.
shall we take a look at the score?
Yes, let's look at the
How are we
scores.
doing?
We're doing quite well. Looks like Padova would not let it go. They're back in the game.
Okay,
All
let's
righty.
carry on.
Cage fight 600.
So, in patients with neurofibromatosis type 1, accelerated growth and increased activity on PET imaging of a posterior mediastinal mass may indicate transformation into this more aggressive tumor type. 3, 2,
What is a leiomyosarcoma?
Thoracic judges? Incorrect.
wrong.
Minus 600. Iowa? Three, two, one. They're gonna let it go. All righty. Who had control of the board last?
The answer is
Oh, the answer is a malignant nerve sheath tumor. Okay, I believe Iowa has control of the board?
They do.
They do. Okay, Padova, go ahead.
Hall of Fame 600.
All right, Hall of Fame 600. A commonly used chest wall retractor is named after this French surgeon, the first to describe plombage for tuberculosis and the first to perform a pulmonary section for the same disease. Iowa.
Who is Finichetto?
Incorrect. Minus 600. 3, 2, 1. Anybody? 2 for you. Excellent. I think Padova still has control.
Okay? Who is
Hall of Fame 400.
Hall of Fame 400? So better known for his work in congenital cardiac surgery, he was one of the first to perform a successful thymectomy in a patient with myasthenia gravis. 3, 2, 1. No one? Okay. Blaylock. Dr. Blaylock.
Okay. Padova, I believe you still have control.
Happy Pill 600.
Happy pills for 600. This medication is often given systemically to visualize the intersegmental planes during lung resection. Iowa.
What is Indocine in green?
What is Indocine in green is correct. All right. Iowa gets the board back.
So let's check the score.
Okay.
So University of Iowa is ahead with 2,000 points. Padova 1,200. Okay. Let's move on to the next
At least it's
question.
competitive. We like it a little competitive. Iowa, go ahead.
Happy Pills 800, please.
Happy Pills 800. Oh, daily double.
We'll wager 1,000.
All
1,000.
right.
Okay.
1,000 on the board for Iowa. Let's see.
So this medication, developed in 1945 in Basel, Switzerland, is given to myasthenia gravis patients. 3, 2, 1.
No answer. All right.
Other one?
No, that's it. Yeah, it's minus 1,000. Unfortunately, Padova can't steal it because it's a daily
All right.
double
Sorry.
per distigmy. Okay. Iowa, I think you still have the board.
We'll do Happy Pills 1,000, please.
Happy Pills 1,000. This class of medications are the most effective treatment for desmoid tumors. 5, 4, 3, 2, 1. Answer coming up. What are gamma secretase inhibitors? That's a tough one. Brutal. All right. Iowa?
Cage Fight 800.
Whoa, another daily double.
We'll do 500.
500 this time. Okay.
Ready?
So more common in patients with a genetic colonic condition, this is a benign tumor arising from the muscular aponeurosis, often seen as a painful mass in the chest wall fixed to the deeper tissues. Three, 2, 1. Okay, so you lose.
That's it.
Okay.
What is a desmoid tumor? We just talked
What is
about
the
it. Brutal. All right.
So if we look again at the score, things have changed a bit. Padova is now ahead by 700 points.
Yep.
So let's see what happens next.
Common Bonds 1,000.
Common bonds 1,000. Failure of connection between the left aortic bud and the epicardial arterial plexus is the etiology of this congenital abnormality.
What is El Kappa?
That is right. Excellent. 1,000.
Hall of Fame 800.
So in 1954, Dwight E. Harken was the first to perform this procedure using a laryngoscope.
Anyone? Oh,
What is a mediastinoscopy?
good job.
It's a good one. Congratulations.
Okay. Iowa.
Hall of Fame 1,000.
Hall of Fame 1,000. Now considered a precursor to cabbage, the direct implantation of the lima into the myocardium of the left ventricle was developed and first performed in 1950 by this person.
Who was Sokolov?
No.
No. Minus 1,000.
It's on Wikipedia. Actually, I think on Wikipedia it's Sokolov. It has been debated.
So we
Judges, judges, judges. Anyone feel differently?
They're researching. They're researching.
Yes.
I think
Yeah.
Wimberg was the first one to do this. I don't think Sokolov did a grafted lima onto the myocardium.
Yep.
Not on the myocardium.
There you go. All righty. So the answer was Wimberg. Yes. Okay.
Okay, Iowa.
Cage Fight 1,000.
Whoa, whoa, whoa. Now this is becoming interesting. So you're going for 1,000.
Yes.
All right.
Yeah.
Yep.
So symptoms of this diagnosis include a restrictive, narrow, bell-shaped thorax and short horizontal ribs, resulting from poorly progressing endochondral ossification. Three, 2, 1. Okay. So what is the right
Yeah,
answer?
June syndrome. Asphyxiating thoracic dystrophy. That's
All
the
right.
tough one. All righty. So I believe Iowa still has control of the board.
Get the beat 400.
Get the beat 400. Comprising of approximately 7 to 10% of cardiac neoplasms, these tumors present with embolic phenomena and the appearance of a frond-like mass with multiple projections. Padova.
What is a cardiomyxoma?
No. Minus 400.
What is a fibroelastoma?
Correct.
Okay.
Common bonds 400.
So this ventricular septal defect is located below the pulmonic valve.
What is a conal VSD?
No, that's not the correct answer. Iowa?
What is outflow VSD?
Judges?
No.
Okay. Wrong for both.
So what is the answer?
Yes.
What is an outlet VSD, supracrystal VSD? Is that? Oh, the second one
The
is
second
correct.
one was correct.
Okay, all right.
Okay. So Iowa gets the points. Good job. Yes. Okay.
So,
They did sit out, yeah.
yeah, okay.
So we're corrected that.
Are we ready to move on?
Yes. Yes. Iowa score is correct. Padova score is correct. Yep. Okay, Iowa.
Cage fight 400, please.
Cage fight 400. The presence of this additional osseous structure may lead to the development of thoracic outlet syndrome.
What is an additional rib?
Judges? Are we thumbs up, thumbs down? More specific. One shot to fix it.
Cervical rib?
Correct. All right, so Padova gets a little bit back.
So
Get the beat 200.
get the bit. So in valve replacement, an effective orifice area to body surface area ratio below 0.85 may result in this.
What is patient prosthesis mismatch?
That's correct.
All righty, before we wrap up, let's take a look at the scores real quick. Iowa, continuing their dominating run of positive scores against negative scores. Hopefully we get Padova back on the board so we can have a competitive final Jeopardy here. All right.
Happy pills 400, please.
Happy Pills 400. An asymptomatic thoracoabdominal aneurysm should be electively repaired when it reaches this size.
What is 55 millimeters?
Correct. Good job. Way to get back.
Finalmente siamo positivi. Se stiamo zitti.
Okay? You choose it.
Common bonds 200.
Common bonds 200. So this is the most common surgical approach for the repair of vascular rings.
What is thoracotomy? What is left thoracotomy?
That's correct. Left thoracotomy. Well done.
Cage fight 200, please.
Cage fight 200. This is the eponym for an anterior mediastinotomy.
What is the Chamberlain procedure?
Correct.
So nearly there.
Oh, nearly there.
Hall of Fame 200, please.
Okay, so in 1954, this person used cross-circulation for the first time to repair a VSD in a 3-year-old boy using his father as the donor.
Who was the lily eye?
Good job.
Well done.
All righty. On to our last question.
Happy pills 200.
Okay. This metal is part of the class of medications that are the core chemotherapeutic agents used in treating non-small cell lung cancer.
What is platinum?
Correct.
Correct.
Good job, guys. All right. So let's look at a quick recap. Iowa is at 3,700. Padova is at 600. So to review the rules, we're going to show you the category. You're going to wager, and then we're going to show you the question. Okay? Can we get a big round of applause for all our participants and all their hard work to get to this point? Okay. So the category is the active heart. Okay? So you guys can write down your wagers for the category of the active heart.
Why don't they show them to the audience? We'll have you show your wager.
Yeah. They should answer and then show. They should answer and show. Yeah. Keep your wagers to yourself. Okay. All right, do you want to do the last one? Yeah, I think you should.
All right, so let's get the final question.
Okay.
So this is a mitral valve issue. This is a mitral valve disease seen in patients with hypertrophic obstructive cardiomyopathy.
You have a minute to respond.
Yeah, it's a really nice icon.
The contestants have until the end of this song to write down their answers, and then we'll have them show. So let's give another round of applause for their hard-fought battle.
All righty. So we will start with the group with the lower score. So Padova, could you give us your answer?
So we wage 600.
Yep.
And what is a systolic anterior motion of the anterior mitral leaflet?
That is correct. Excellent job. So that brings them up to 1,200.
And we wagered
Iowa.
100, and we said systolic anterior motion.
Congratulations. All right, and with that, University of Iowa are our winners. Yes. Let's do the trophies.
We would now like to confer
Great
trophies
job,
to
guys, all around.
our champions and our semifinalists. Thank
Gentlemen.
you both to the University of
Gentlemen,
Iowa and the
thank you for
University of
your
Padova
participation and hard
for
work.
making this competition a success. We really appreciate it.
Well earned. Congratulations, gentlemen. Congratulations.
Well done. Great job.
Yes. Great job.
Well done.
All right, thank you so much to everyone. Thank you to the STS staff. Thank you to Dr. Myers. Thank you to Dr. Benor, Dr. Meyerson. Thank you to our judges. All righty, let me get out of your way.
You all still going on social media. You can stand next to me.
Tower.